This is Real News Media TV, coverage you can trust.
COVID-19 cases spike at 3 hospitals. Health officials worried. 3 of Jamaica's primary healthcare facilities are currently near COVID-19 capacity, with others close to the danger zone as the country has seen a spike in cases of the pandemic over recent weeks. According to healthcare officials who were speaking at a hastily convened online COVID-19 press conference on Saturday evening, the rise in cases is mainly in the western end of the island, and the situation has placed a strain on the health facility there. Spanish Town at 88%, Falmouth at 89%, and Linstead at 123%. The island's largest health facility, Kingston Public Hospital, is hovering just below the red zone with 84% of COVID-19 bed space being occupied, the same as Black River Hospital. Percy Jr. and the Mandeville Regional are both at 77% capacity for COVID-19, with Savannah Lamar at 82%. For isolation beds, Noel Homes in St. James is at capacity, with Falmouth exceeding the necessary number at 128%. According to Besesa Mackenzie, the situation in the western end of the island was worse recently when health authorities had to enforce restrictions on Westmoreland, with Savannah Lamar Hospital having a high occupancy capacity for both regular COVID-19 cases as well as for isolation. This is something that we continuously monitor so that we can find, as soon as the hospital enters that red zone, which is above 85% capacity, we can start to look at interventions to try to manage that situation to prevent an overwhelming of the system, said Besesa Mackenzie. Minister of Health and Wellness, Dr. Christopher Tufton, said that the situation is of concern since the island's health authorities have fought from the beginning of the pandemic in March to keep the public health system at an acceptable level. I really want to help the public to appreciate what this means, because the entire process around the public health response to COVID has been to not allow the public health system to be overwhelmed, said Tufton. We have been working at this. This has been at the core of everything that we do, and to the extent that we are now seeing signs of that is cause for elaboration and for emphasis on why it is important. I think it is important to just emphasize that if we get to a stage where the hospitals cannot handle symptomatic cases that require hospital treatment, the next best thing is to move around persons by shifting to other hospitals. But assuming challenges there, then we become almost impotent, if you will, to provide the level of hospital care that is needed for those persons who are the most severe, and we just cannot allow this to happen, said Tufton. Meanwhile, Besesa Mackenzie said currently 47% of the COVID-19 beds that are available are being used. She said of the 370 COVID-19 beds on the island, 174 are occupied. Please remember to like, share, and subscribe, and hit the notification bell. Select all so that you get daily news updates.